One of the biggest questions we hear from parents is what type of assessments are even available and how do we know what to ask for? Let's start with an overview of the types of assessments that are available with families.
To say the most commonly, I would say administered assessments, and also areas that I hear parents wanting to have an assessment, but maybe they don't know there is an assessment. So obviously the kind of overall psychoeducational component, so looking at processing, cognition, then the academic assessment, so looking at how the student is performing either pre-academically if they're younger, or how are they in comparison to their same age peers across all areas in academics. Then there's like speech language assessments, or, obviously a very common one. That's probably the next most common service under SAI, specialized academic instruction. Motor assessments, so fine motor, occupational therapy, gross motor physical therapy. There's APE. That's one I find a lot of parents aren't familiar with, actually. So even though your child may not have like needs as far as physical therapy, but maybe they're struggling motor wise in terms of participating physically with like sports or games or activities, or even on the playground, consider an adaptive PE assessment. I guess to kind of follow that line of thought, like a recreation and leisure assessment is one many people don't know exists.
Yeah.
Again, if they're struggling with playing or socialization, that's a good one. There's assessments for social emotional needs. So looking at intensive individualized counseling on the school setting. The two most common I get from parents that either don't know exist or want to be assessed in is a functional behavior assessment. So if the student is struggling with behavior in the school setting, and also one-to-one aids. So a lot of parents don't know that there is an assessment for that. Personally, I think it's very subjective, and an FBA should just kind of envelop that. But nonetheless, there's an assessment process. So if a parent does want an aid, they should initiate that request.